Hey, Amy, thank you very much for getting us started this week on our week 6 discussion as we talk about how we as clinicians and counselors in training um, are to be culturally competent when working with our clients. Now, as we all know, the concept of being culturally competent is that we are able to see the worldview of our clients, right? To understand, or I should say, better understand the worldview of our clients, to be accepting of learning more about our clients and their belief system and value system. Now, keep in mind, this does not mean that we are saying we agree with them 100%. Far from it. But we have to have the capacity to understand their lived experiences. And one way of doing that is being open to hearing about those experiences and not just pushing them off. Because oftentimes when we do that, we are demonstrating a level of bias in that we're looking at their experience through our own experience. Then, and by doing so, we're trumping their experience, devaluating or excuse me, devalidating their experience. So being culturally competent is part of that piece. Now, you spoke of your ancestry of Irish heritage, which is great. But I want us also to be mindful that we're not just looking at one aspect of one's cultural identity. We're looking at and open to the multiple identities that our clients bring to us. So, take me, for example, identify as being a cisgendered African American male, person of faith, veteran, uh, that's that is divorced, has been divorced with 3 children, grown children, that was primarily raised in the North, but was influenced by the South. So, as I share that with everyone, there are multiple identities that are being presented. Okay. And it's important for us to recognize those multiple identities. Now, I may only connect with one, two, or three of those identities specifically for me. And it's important for the counselor to recognize and understand that. Okay. We do that through our own work. Hear what I'm saying? We do that through our own work. This means seeking out consultation, seeking out supervision, seeking out professionals that may have similar cultural identities as the client that you're working with. Okay. We are not, let me be very clear, we are not um, looking to have our clients be responsible with our education of their cultural identity. Does that make sense? They are there to receive help on their emotional, mental, cognitive state. And it is not okay for us to put that additional pressure on them by having them require, right? Having them require to teach us about their cultural experience collectively. Because, as you said, Amy, uh, you they may not be that connected with their ancestry, as you said about your Irish ancestry. You know you're Irish, and that's great. That's exciting. But to your point, did your Irish ancestry influence you in your upbringing and current traditions and the way you see things and the way you see the world and the way the world sees you currently? That's the piece that we need to talk about. So again, as I talk about my multiple identities, we know in the field of counseling is predominantly female. Historically, it was predominantly male. Pendulum switched, now it's predominantly female. In the teaching space, particularly higher ed and in counselor ed programs, most of the counselors, most of the professors are female, okay? My male identity status brings me a level of privilege, just being a male, right? However, when I interact within my profession as a counselor and a counselor educator, that privilege shifts. Why? Because many of the individuals within that system are women. So I become the marginalized individual in those spaces. You add the factor of being an African American, that's another level of identity that I may be marginalized in based on the space that I'm operating in. Now, I attend church, and I attend church in a predominantly African American church. In that space, my African American identity provides a level of privilege for me in that space. But once again, in that space, along with my able-bodyism, as well as my male identity, those elements provide a level of privilege in that space. Whereas the women in the church, being a woman, just simply being a woman, they excuse me, their privilege is limited, and they may identify as a marginalized individual in that space. So this is what I'm referring to of understanding and recognizing the multiple identities of your clients that you're working with. Now, when we specifically talk about military population and first responders, you brought up an excellent point that all counselors must be prepared to do. Meaning, when you become a counselor, when you are a counselor in training, it's important for us to recognize when we sit down across from a client, we are essentially saying, I am equipped to hear, receive all of your emotional vomit in this moment. I am able to receive and hear it, okay? And if we're not, then we need to do some work for ourselves to get there, okay? That's essentially what we're saying. And what I mean by emotional vomit, all their stuff. So whatever they might be dealing with, going through, we are saying that this is a safe space for us for them to communicate and share this without judgment, all right? Without judgment. So when we're talking about these particular populations and groups, because we know first responders and military have their own cultural group, it's important for us as counselors, one, to become educated about those spaces, all right? There are many resources out there that allows counselors to become trained on military language, military jargon, rank structure, things such as that, so that we can feel more comfortable engaging in a conversation with our veterans. Same thing applies to first responders, okay? There's a set of language and jargon and behaviors that are particular and specific to this population. We as counselors need to learn that language and that jargon so that we can create a more comfortable environment with our clients when we're working with them. By doing so, this potentially can increase that therapeutic relationship, all right? So while we're also identifying cultural differences, we should also be looking to identify cultural similarities, just as you pointed out, Amy, as you talked about being human, right? So even though I identify as African American cisgender male, you identify as, if I'm not if I'm not mistaken, um, Irish female, uh, middle class um, individual. There are clearly some identity status differences, but there are also some identity status similarities simply by being human, right? Simply by being human. And it's important for us to engage in conversation about that as well. And one of those is simply being a veteran, right? We have shared experiences of what it is to be a veteran. And I think I shared with everyone part of my service was at combat medic. So I even have the first responders uh, experience as well um, in that particular MOS, that particular job, that particular experience. Because to this day, I am a certified paramedic. So again, I appreciate you getting us started this week. Look forward to continued dialogue and discussion. Take care.